Okay, this is day one of the vaccines at the Elders Lodge. We are now starting to give all our elders their first dose of the Moderna vaccine.
So we vaccinated all of our long-term care residents. It was a really big day for staff and for the residents as well. The staff were really excited. It was a great teamwork as well. We had everybody there watching and helping out, and the residents were excited as well too. They were all happy to be receiving the vaccine. When we got around to some of them, they were even asking, like, we were waiting for you to come around to us. So a lot of them were really anticipating it. So it was really nice.
About 100 of our employees, both from KMHC Inpatient, Elders Lodge, and ILC, have been vaccinated, are doing very well. They've all received their first dose. There are very few side effects. And that's the Pfizer vaccine. So we continue to vaccinate health and social service workers with the Pfizer vaccine. The next groups within health and social services that have been prioritized are mostly hospital workers, so ER, operating rooms, dialysis units, COVID wards. We do expect a very quick movement within the next week or two for all health and social service work employees to have the ability to be vaccinated with the Pfizer vaccine. So that would include KSCS and KMHC for the time being, but we're also pushing for first responders.
I received the vaccine on December 30th. It's actually not painful to get the vaccine. You could have a sore arm later, but when I got it, I didn't even feel it. So. It's not one of those painful ones that you have to worry about. I did experience some of the expected side effects like fatigue, headache, and joint pain. So I stayed in bed the next day for a few hours, but by 4 o'clock the next day I was up and about and able to continue with my regular daily activities.
So I got mine on the 27th of December, and it went well. I didn't really have any side effects. I was a little tired after, but I think I had more side effects from the flu vaccine in the past than from this one. So I decided to do it for a few reasons. One is to contribute to, I know we need 80% of the community to be vaccinated, so I wanted to do my part and contribute for myself, for my family, for our residents. But I also just want to be done with this already. We've been doing this, it's been a long haul now for us with the masks and everything, and so I'd like for us to get closer to the end of this, and hopefully we'll be there soon.
I've experienced firsthand the effects of the virus itself, and I didn't want anybody else to have to go through that because I work with vulnerable populations, and I wanted to help protect my community. I did my research the way I would do a research for any vaccine that I would give to a baby, and all of the science was there. It's not something brand new that they just came up with. I don't expect to have any very strange side effects, so I do encourage as many community members as possible to get the vaccine.
We also will most likely be vaccinating ILC next week, just in the process of working that out. Again, things change every hour, so we get new information all the time. As you know, the second dose, Quebec has delayed the second dose so that they can have more of the first dose. They're able to vaccinate more people. And so we still don't have a lot of information about when that second dose will be administered. The last update regarding vaccination is with respect to prioritization of First Nation communities, not just remote communities. So it's our understanding that over the holidays, an agreement was made between Indigenous Services Canada, the Minister of Health, and the CIS CHSs and CUSs, so those are the regional health centers, that all First Nation communities would be prioritized in priority 4, so at the same time as remote communities. And so we're just in the process of figuring out the logistics about that. So the information did not yet get down to the different regions, but we're working on that. The Longhouse has very generously allowed us to use the bingo hall for mass vaccinations, and the site is being prepared as we speak, and we hope to have it ready quite soon. Once it starts, it will take about 2 weeks for the approximately 6,700 people who are 18 and over, because as you know, the Moderna vaccine is for 18 up.